my recovery time was like insane. Like my incision was like, it's nuts. Like it's crazy how it works. I actually wish I would have daily photographed my incision, and I didn't, but kind of regretting that now.
Next time, if you, hopefully
next time, right?
Hopefully there's no. Okay.
Welcome back to the Aging Backward, Growing Forward podcast. And today I'm thrilled to bring a guest on that I've known for about 2 or 3 years now, Dr. Scott Sherr. Dr. Scott Sherr is an internal medicine doctor that's got over a decade into hyperbaric therapy science and the background, and he's been a medical director. He's going to bring us some incredible knowledge today. We're going to talk about a hyperbaric therapy, of course, but we're also going to talk about some mitochondrial things. And Dr. Sherr's got a wealth of knowledge. I am a big fan of hyperbaric therapy. I found out about it, and I learned so much about it by my conversations with Dr. Sherr. So I'd like to now formally introduce you to Dr. Sherr. Dr. Sherr, welcome to the show.
It's good to be here. Nice to see you.
Doc, we're going to jump right into it. I wanted to just give an overall background of what hyperbaric therapy is and how does it work?
All right. So we're going to go with the short version here. So I do whole talks on this, as you know, Eric. So I think the easiest way to think about this is there's two major factors here. There's oxygen and pressure. Okay. And so the definition of hyperbaric therapy is a combination of increased inspired oxygen and increased atmospheric pressure. So I like to take oxygen first because most people know about oxygen because it's kind of important. Without it, we don't live for very long. Oxygen's what's called the final electron acceptor in your mitochondria, which means it helps you make ATP. Without oxygen, we can't make ATP, which is our energy currency. So in a hyperbaric chamber, we can increase the amount of inspired oxygen that you typically would breathe, which is typically 21% at sea level. Where I live just outside of Boulder, Colorado, we're talking about 16% oxygen. But regardless, you can actually do something in your system called increase your oxygen carrying capacity in a couple different ways. Now, typically when we have oxygen in the system, it's carried on red blood cells. Red blood cells have a molecule on them called hemoglobin. They have 250 million of them, actually, and each of them can bind 4 oxygen molecules. So each of your red blood cells can actually bind 1 billion oxygen molecules. So it's pretty significant, as you can imagine, but we need a lot of oxygen in the system to maintain our energy capacity. We are going through ridiculous amounts of energy every second, and we have to be able to replenish that. Oxygen is required for all of that. Now, oxygen carrying capacity is typically by red blood cells, right? And there's only a couple different ways to increase your oxygen carrying capacity. One of them is by increasing the number of red blood cells you have in circulation. Now, how do you do that? You go altitude training. So you can come to Colorado and you can increase the number because you actually secrete a hormone called epogen when that happens. Epogen is also something that's been taken exogenously by anybody from cyclists to bodybuilders, anybody in between, because it's going to increase your red blood cell density, the number of red blood cells. So the more red blood cells you have, the more oxygen you can carry. But there's another way to increase the amount of oxygen in circulation, and that is by actually increasing your atmospheric pressure. So that's the other part. So hyperbaric therapy, the combination of increased atmospheric pressure, which you simulate the pressure you feel under a certain amount of seawater, that pressure changes your physiology in a way that actually drives oxygen into the liquid of your bloodstream or in the plasma of your bloodstream. So you can get up to 1,200% more oxygen in circulation as a result of creating a pressurized vessel that combines with increased inspired oxygen to drive more oxygen in circulation. So it's the combination of the increased inspired oxygen plus the pressure itself. You need both of those two things to actually see an increase in oxygen circulation.
Wow, that's a lot of science you just dropped. So hopefully we'll put some show notes in here, and we'll add some taglines to define some of those terms.
What needs to be clarified? Tell me.
So I want to back up just for a second about atmospheric pressure.
Sure.
So because this is confusing to some people. In fact, it was for me at first. So hyperbaric chamber, you're simulating going below sea level, so almost like you're going in a submarine.
Exactly.
So can you tell us about the different, because I know there's different types of chambers and different types of atmospheric pressure where the magic, as I like to say, starts to happen. 1.3, 1.5, I know is a very magical number, then 1.7, and then even above into 2.5 in some therapeutic. Can you explain to our listeners, Doc, so they know and they can ask educated questions when they're going for therapy about the types of atmospheric pressure?
Yeah, so think about it this way. So if you're 15 feet below sea level and you're looking up at all that water all that water is extremely heavy. If you pick up a bucket of water, it's heavy. Maybe not for you, Eric, with your guns there, but for me, it's heavy. Okay, and so the water, that heaviness gets heavier the deeper that you go. And so at 1.3, that's about 14 or 15 feet of seawater. At 2.0, that's 33 feet of seawater. 2.4 is about 45 feet of seawater. So if you think about that pressure, it's that pressure that's actually changing your physiology. So the pressure is working on your lungs, and that pressure drives that oxygen in, because there's a physics law, it's called Henry's law, that just says the more of a molecule that you have under pressure that's in a gaseous form, the more pressure you put under it, the more that it's going to go into a liquid form. So we have all these various types of pressures that we use in a hyperbaric chamber depending on the indication. So we know that our brain, for example, and our central nervous system is more sensitive to oxygen and pressure tensions as opposed to the rest of the body. So what that means is that at a milder pressure, like a 1.3 to 1.7, you're really getting more blood flow and more oxygenation focused to the brain, because that's where the brain is kind of more optimized when it comes to pressure, as opposed to going to deeper pressures when you need a more systemic, like full body oxygenation, like oxygen tension in your toe, for example. You need to have more pressure, more oxygen. And then as you go down, there are different things that happen. The deeper you go, the more inflammation and the more swelling that you're going to decrease, for example, very acutely. So for acute trauma, for example, where I trained, you'd have people going to deeper pressures, 2.4, 2.5, 3.0 sometimes, for things like carbon monoxide poisoning or flesh-eating bacteria, which is also called necrotizing fasciitis, or acute lack of blood flow to a particular organ, for example. And so you have a lot of studies that have been done at those deeper pressures for these really significant wounds. And then there's more studies that have been done over the last couple of decades looking at the 1.5 especially, or 1.75 for neurologic kinds of things, as I was describing to you.
Doc, you're leading me right into my next question. My next question talks about, what are some of the benefits that you could talk about for brain function with hyperbaric therapy?
So I think the major way to think about this is that what happens in a chamber is that you have an acute infusion of all this oxygen. You have up to 12 times more oxygen, depending on the pressure. And then as a result of that, you have this cascade of things that happens immediately. And then over a protocol of hyperbaric therapy, then you have a different level or a different suite of things that are happening over a cascade of multiple treatments. So acutely, what you're doing is you're reversing low oxygen states, number one, because you're getting more oxygen into tissue. And this is really important if you've had an acute trauma of some sort where you have lack of blood flow going to an area. This could be a surgery, for example, like you've just ruptured your Achilles tendon, for example, and you have less oxygen getting there. Or you have like a surgical wound or you have acute trauma, like you've gotten into a car accident, or if you have acute heart attack, acute stroke, traumatic brain injury, spinal cord injury, there's good data to say if you can get into hyperbaric therapy very, very fast, you can save tissue from dying. But this doesn't have to be all even that severity. It can even be mild things, like mild trauma can still significantly benefit if there's a relatively low oxygen state. In addition, over the long term, over a hyperbaric protocol, what's happening is that you're creating more blood vessels in areas. This is called angiogenesis or revascularization. So you get the ability to create more blood vessels in the tissue to sustain that tissue over a long term, because you need to have blood vessels going to the area and that are vital so you can get all your nutrients to the tissue too. So that's the first thing. So acutely reversing low oxygen states, and over the long term, rebuilding the oxygen supply to the tissue by recreating more blood vessels. There's more. There's the second thing that happens is you have an acute decrease in inflammation. This happens because you have an acute decrease in swelling as well. And then over the long term, you actually have a downregulation of these various chemical factors called cytokines and hormones that actually modulate inflammation over the long term. So that's really important too. Third thing that happens is that you have a release of stem cells. Stem cells are the baby cells in our body that can make any different type of cell available. And they get released from the bone and released from the brain and go to the areas of the bone or to the body or to the brain that require these stem cells if there's inflammation, if there's infection, et cetera. So, and then over the long term, these stem cells start maturing into their various types of cells that are required. Fourth thing is that you have immune system function, enhancement of immune system function, both immediately and over the long term in various capacities. Fifth thing is you're fighting infection. That's mostly an acute thing, but over the long term, if you have chronic infections, hyperbaric therapy can be very, very effective there. Sixth thing is that, and this is the final one, six is that you're increasing blood flow and lymphatic flow, so that even though the short way of saying it is that blood flow enhances overall because you get more oxygen to tissue, and that there's also more enhancement of the detoxification system or lymphatic flow. And this is actually more related to pressure than it is to the oxygen itself. You can think of being under pressure as being like under a microvascular massage to some degree as well. So those are the major ways of thinking about it. And so all this is reflected in the brain, Eric, just like it would be reflected anywhere else. So you can see there have been studies that have been done on stroke patients, for example, that have had a stroke. They have an area of tissue death in their brain because that's what strokes do. But around that death is all this area that's not functioning as well. It's called the technical term is the periischemic area, or like around the area that was dead. That tissue is not dead. It's just not functioning very well. So what you can do is revitalize that area by enhancing the blood flow, getting the stem cells, everything we talked about, and then you can actually make that tissue come back online. So that's just an example of what we're looking at from a macroscopic level when I'm talking about all these microscopic things that are happening underneath.
No, it's so amazing. I'm enamored by it. When I started reading some of the studies and the reports, and I'm going to ask you another question that has to do with brain as well, because it's something that I read about. So we talk about it with athletes with concussion protocols. Yep. I assume based on what you just said, the concussion protocol, what I had read, the benefits of hyperbaric there, I assume has to do with the inflammation component. Is that what it is really where the benefit is?
It's all things that I've just described, right? Because the tissue itself is going to be at risk if there's been damage or injury. So there's going to be some tissue that's not going to have as much of an oxygen supply as it did before. There's going to be inflammation. There's going to be swelling. They did a study on these severe TBI patients. It's actually being done now. Again, it was called the phase 2 trial. Now they're doing like the final trial called the phase 3, where these patients had severe brain injuries. And they just did 3 hyperbaric sessions over the first 3 days when they got to the ICU. And their mortality rate was cut by half. So 50% less mortality. And the people that responded the most were the ones with the most intracranial swelling. So because we know hyperbaric therapy can decrease swelling in the brain, and it does this in a number of different ways we don't need to get into, but in the sense that you're decreasing inflammation, decreasing swelling, that's a big deal if it's your brain. Of course it's a big deal if it's your knee, but if it's your brain, you have a cranium here, you have a bone. Right. So what they'll often do, like if you have a severe injury, is they'll take part of the bone out so that the brain can swell, and they'll put like a drain in there. But at the same time that they were also putting them under hyperbaric conditions, and they had 50% less mortality. So it's a big deal. Amazing. And this is not just if you have a severe TBI. I mean, I've seen this countless time in people with severe or mild to moderate, concussions. Myself as an example, I did this to myself like 3 or 4 years ago. Some ridiculously, I don't have a great story about it. It was just hitting my head on a bathroom wall. But I realized that I had a concussion. I was like, oh shit, I know what to do.
That's awesome.
But I was just a very interesting process for me, because I was in denial that I had a concussion. I was like, I don't have a concussion. No, wait, I do. And so it was a good process for me to go through as well. So, but anyway, so yes, absolutely helpful for concussions. And we have very significant experience with various protocols that can be very helpful there. And the other thing to mention is that if it's more of an acute issue, you don't need a lot of hyperbaric therapy to see a huge shift. If it's more of a chronic, long-standing issue or goals, like say you have chronic Lyme disease, or you've had a stroke 3 months ago or longer, or you have mild cognitive impairment, these are not things that I would call acute. These are things that have been happening for a long period of time. And oftentimes it's not just about getting into a hyperbaric chamber, as you know, Eric. It's about what are you doing from like a ground game perspective, hormonally, nutritionally, lifestyle, exercise, and all those kinds of things that really are important when it comes to recovering from a long-standing issue or a chronic issue, or you have a long-standing goal, like, reversing your age, or maybe aging backwards, as you would say, I guess. So.
Which is going to drive me to a point that I'm going to get to in a second. I want to talk about telomere length and the study that I had read about. I think they did that study in Israel about a year or two ago. Yeah. But we'll get to that in a second. I just want to stay on the brain for a second. Is there a benefit for Alzheimer's and or Parkinson's people as well?
So the answer is yes, but in the sense that it's not it's not just about getting into a hyperbaric chamber in these capacities. Oftentimes, it's related to a lot of cellular optimization that's required, a lot of detoxification, sometimes infection, other kinds of things that need to be addressed. Right. Then hyperbaric therapy can be something that can be used as an adjunct to help rebuild in the ways that I've just described. But I have had very little success in people that do nothing and just go into a hyperbaric chamber. Now, sometimes I'm surprised. Sometimes people will feel remarkably better, but even in those people that do feel better, they don't feel better for long typically because they hadn't done anything different that got them to the place that they were, So it's the classic scenario. You can't out supplement a shitty diet. You can't out exercise a shitty lifestyle diet. You can't out hyperbaric all that stuff too. It's the same deal.
Which makes a lot of sense, and that's the whole package, right? And that's kind of what we talk about. Even it's one of the reasons why I created serotonin, because it's that whole circle of life, as I like to call it, and everything kind of connects. And that's why we started bolting on all of these different things. Red light therapy, hyperbaric obviously came in, IV nutrition, and then obviously giving nutrition coaching and exercise coaching. That had to be part of it because it's the lifestyle thing. So a huge advocate of everything you just said. But Doc, so moving into another category, and some research and some things have come out, and I think it might have been the first person that mentioned this to me. What is the benefit for hyperbaric therapy for cancer patients, for people that are going either through chemotherapy or have just been diagnosed with cancer?
All right. So this is also a long question answer, but I'm going to be quick about it. So there's about seven or so different ways hyperbaric therapy can be used in cancer care, cancer therapy, et cetera. There is one way. The first way is actually approved by medical insurance in the United States. It's radiation injury. So if you've had radiation from a cancer diagnosis and you have an injury that lasts greater than 6 months, or that occurs 6 months or later after your radiation, then that is an approved indication for hyperbaric therapy. And it's fantastically effective and vastly underutilized. What you're doing when you radiate somebody is that you're basically depleting and destroying tissue beds of blood vessels and of stem cells. And so you can rebuild all of that using hyperbaric therapy. So really effective. So that's the first one. So the second, all the rest of the ways are what we call investigational, which means that they're not covered by insurance. But you have things like, we know hyperbaric therapy in studies, it makes chemotherapy potentially more effective. We know that it can make radiation more effective if it's done in very close proximity to the actual radiation itself. Somewhere between 15 and 30 minutes, actually, is the study. So if you can get radiation and then get into a hyperbaric chamber 15 or 30 minutes later, that combination can be very, very effective. Another way that hyperbaric therapy can be very effective is in combination with what we call with other oxidative therapies. These are therapies that may not be standard of care, but things like IV vitamin C, for example, or mistletoe, artemisinin, but usually in combination with the ketogenic diet as well. So, and there's a lot of work that's been done here. There's a researcher named Tom Seyfried and also Dom D'Agostino, who I think Eric, who's close to you. Yeah. And Dom's done a lot of work in the ketogenic diet for many years. And so we talk about something called the press pulse technique, where you're pressing with ketogenic diet and you're pulsing with hyperbaric therapy. There's also surgical recovery. So you can surgical recovery, any surgical recovery, but including in cancer, hyperbaric therapy can help with surgical recovery. Ideally, you get into the chamber before surgery, at least a couple treatments, and then you do hyperbaric therapy afterwards. This is any surgery, by the way: plastic surgery, nose jobs, oncologic surgeries, everything in between. Yep. You can get about 50% faster recovery using hyperbaric therapy on average. So it's pretty significant. Wow. So I have a lot of NFL players, a lot of NFL teams and others that reach out to me, especially recently, asking me about these kinds of questions. So, and then hyperbaric therapy can help also with quality of life. If you have, if you're anemic, for example, because you've been going under chemotherapy, you have less of those red blood cells floating around. Hyperbaric therapy is going to make you feel better because you have a lot more oxygen in circulation when you're getting in the chamber. Yeah. So, and then also, I guess the last one would be that if you have mitochondrial injury from chemotherapy, this is often can present as something called chemo brain. This is also something that hyperbaric therapy can help with, because it's going to help rebuild mitochondrial function and it's going to help decrease inflammation. Wow.
It's crazy because you don't hear about this at all, really. I mean, it's so rare that, and even like I said, my mother, she went through a tremendous amount of cancer treatments. God rest her soul. It was, but like, and this is a while ago now, but even today, like no one talks about this stuff. Like it's, unless you're in our circle. And I say our circle, like you're in the industry and the fields that we're in, and whether it's anti-aging or functional medicine, but these are really good bites of data. And now there's people that have some, again, experience in this, and they're seeing results, and I just hope it gets more popular because it's readily available. I mean, people don't realize this is, not only just places like Serotonin, but there's hyperbaric chambers in hospitals. There's hyperbaric chambers in there's companies that just hyperbaric.
Yeah. It's growing by leaps and bounds over the last 3 or 4 years. I think the pandemic was a big part of that, and people realizing that they needed alternatives to getting better and to keeping healthy and to optimizing. Sure. And so I think over the last 3 years, Eric, it's just kind of blown up, to be honest. There's a lot more hyperbaric companies, but what I get more excited about personally is clinics like yours that are integrating it in more of a holistic way with other types of modalities and therapies. And I work with clinics all over the world that are integrating hyperbaric therapy into their practices, and with any kind of any number of modalities that you can imagine, everything from working with a chiropractic neurologist in Maine who does a lot of things just with migraines and traumatic brain injuries and other neurologic issues, and using hyperbaric therapy in that capacity, to biohacking facilities that do all those kinds of things. But I think where the real power here is in a more of a professional setting where you have the ability to do baseline things like labs, nutrient optimization, gut optimization, things like that. Because the problem is that if you go into a hyperbaric chamber and you flood somebody with 1,200% more oxygen, they're going to have to be able to make energy for you. If they don't, they're not going to feel very good. Their body will not tolerate that if you have chronic complex medical illness and you're trying to do that. So you have to be, I've been doing this a decade, as you mentioned. I mentioned in the beginning, I didn't know why some people were just not tolerating hyperbaric therapy very well. Now I know, and it's often because they're under significant amounts of inflammation. Sometimes we call oxidative stress ahead of time. Yeah. So you have to be able to mitigate that. And there's various ways that you can do it. Sometimes you can use IVs if you need to, but oftentimes, I don't know if I mentioned this to you before, Eric, but I've gotten disinvited from speaking at hyperbaric conferences because actually just one. And because the title of my talk was going to be, please do not put them in the chamber. Oh, gosh. And if you have a hammer, everything looks like a nail, man. Right. And so and that's the same thing in the hyperbaric world as well. So my main thing is, it's not if hyperbaric therapy can be helpful, it's when. And the when is super important if you have more of a chronic, long-standing issue. Work on your gut, work on your nutrient optimization, make sure you can detox, make sure you have good antioxidant capacity, and make sure you have all this stuff ready, and then, off to the races. But in context, it's not just like everybody should go right now kind of thing.
Well, isn't it as simple as, and I this is one of the things I actually learned early on, is just taking an antioxidant vitamin, like a nutraceutical that is an antioxidant that helps regulate that as well.
Well, you got to be careful, right? Because the way hyperbaric therapy works, I talked about all the things it does. I talked about all getting the oxygen in. I talked about everything that happens. But how does all that happen? It actually happens because you're creating what you know very well is hormetic stress on the system. Yes. And that's called oxidative stress for others that are listening. Yeah. And as a result of that, the body has to respond to that. It responds to that by doing a number of things like releasing stem cells. The body is doing that because you're creating that hormetic stress. So you don't want to prevent that hormetic stress from happening. However, you do want to know what your baseline level of oxidative stress is, if you can, ahead of time. If you don't, and you're already coming in with chronic complex medical illness, or you're coming in with a brain injury, and you've had it for multiple months, very likely you do need some support. So there was a study done also in Israel back, I think 2013 or 2014, that was done on stroke patients, and they didn't publish the data, but the people that did better also were taking NAC, N-acetylcysteine, about 30 minutes before they got into the hyperbaric chamber. Now, N-acetylcysteine is a supplement that increases a antioxidant in our body called glutathione. So glutathione is kind of like our master antioxidant. So empirically, or meaning if you don't have any laboratory data and you're coming in with some sort of chronic issue, taking something like NAC might be a good idea. But in a perfect world, you have more data to go by.
And that's a great point. It's funny. We actually, serotonin we have an NAC product, and it's specifically, like, we created it because people are so interested in glutathione. And we do glutathione IVs, and we have, injections, Triimmune, we do all those great things, especially coming into flu seasons, and during COVID, they were, really popular. But, NACs, I said, is something just, you keep on your shelf there because it's N-acetylcysteine, it converts, and it's our body's way of making it, but we don't have a whole lot of it in our body, and it's hard to get it nutritionally. So it's an excellent supplement.
It's just the amino acids that are the precursors to glutathione. And we don't know how easily glutathione gets into the brain. We know that the component amino acids that are in NAC do. So yeah, I mean, for the most part, I do supplement with NAC, and I don't supplement with glutathione unless there's an acute issue. So when people travel, taking glutathione is a reasonable idea. But like if you're taking it as your regular supplement regimen or your supplement stack, then NAC is a better plan most of the time.
Yep. Agreed. We're in agreement. So, Doc, tell me a little about diabetics and the benefits for people that have diabetes and why. I mean, I was fascinated by this, and I have a great story about a client who came in as a diabetic that I'll tell you after you tell a little bit of the benefits.
Let's hear the story first. Come on, let's do the story first.
So we had a young girl, and she was a type 2. Actually, I'm sorry, no, type 1. She was a type 1 diabetic. And, her parents, I say young, she was in her teens. Mm-hmm. And her parents asked if she could hyperbaric therapy. We explained the benefits. We showed her, all the consents and waivers, all that other stuff, of course. And while she was in the chamber, she had a great experience. She actually took a nap in there because, again, and I think I want to also preface that what goes on in the chamber, like how do you get the oxygen in? Because we use a concentrated oxygen mask while you're in the chamber. Right. So I think people should understand that because some chambers have oxygen in the chamber, but to really get that percentage of oxygen that I think you're referring to, that 95, 98+% oxygen coming, you need an oxygen concentrator mask on in general, in my opinion, from what I've learned and what we do.
No, I think it depends. It depends on the setup. You certainly want, you want it to either be 100% oxygen in the chamber, where you're going to a medical facility where there's 100% oxygen, there's only oxygen in there, or you're going to a facility that has a good mask that's getting you as much oxygen via the mask itself, and then there's air around you. So you don't want to have, you'll have some people that will just like we talk about bleeding oxygen in a chamber, like without a mask, and that's never a good idea. So that would be the delineation there. But anyway, your story.
So she did the session, and the first thing she said when she got out, like unprompted, just walked out and said, "My gosh," she goes, "I felt it in my toes. I felt it tingling. I haven't felt that feeling." I guess she's getting that toe numbness, which, we know about what happens with that. Yeah. And she was like, she was ear to ear grinning about it, but I was like fascinated by wow, this was an hour-long session. It's the first time she'd done it here. And that was her first instant gratification. She's like, I felt this in my toes. So explain to the listeners what happened there and maybe why it happened.
So the physiology is the same as we've been describing here, but with the challenge with diabetes is obviously, number one, blood sugar is elevated. And when the blood sugar is elevated, it can cause destruction to nerves, and it can cause destruction to blood vessels as well. The microvasculature, so the very, very small blood vessels that feed the nerves, so that it kind of goes together. So diabetics get something called diabetic neuropathy, where their nerves in their feet and their hands, they have tingling in their hands and feet. And then that can become more like what we call a stocking glove, where it can go up to your knees and up to your wrists as well. And so there have been a couple studies that have looked at this. So, there is a medical there's insurance coverage for what's called diabetic foot ulcers. So if you have diabetic foot ulcer that's in a severe stage, hyperbaric therapy is approved by medical insurances for you to get that treated and hopefully get that wound treated before you need an amputation. Unfortunately, it's vastly underutilized for this because of how our system works, but hyperbaric therapy does work to prevent amputations in many cases. When they were looking at these studies, they also noticed that in some of these patients, their diabetic neuropathy was also getting better as well. So the neuropathy was getting better, and probably because you were regenerating those the vessels, the blood vessels in those areas, and helping regenerate the nerves as well to some degree. So that's what we think that as a reason for potentially hyperbaric therapy helping with diabetic neuropathy. So the neuropathy that happens because of these elevated blood sugars. There's some evidence that in some other cases where there is neuropathic types of pain, especially if it's an acute neuropathic pain, like from a chemotherapy drug, which causes a lot of inflammation, mitochondrial stress, or if it's from a other type of drug like ciprofloxacin or some of the flox drugs out there can sometimes see a benefit if you can get into the hyperbaric chamber fast. But in addition, when you go into a hyperbaric chamber, your insulin sensitivity goes up, which means that your blood sugar is going to go down. And so this is only a temporary thing most of the time, but it is something that will also just be part of the process for patients that go into the chamber. So if you're a diabetic and you're going to a hyperbaric chamber, you have to make sure that your blood sugar is a reasonable level because you could drop in the chamber the deeper you go.
Wow. It's amazing. Yeah, I mean, it's fascinating stuff. So speaking of fascinating stuff, I want to jump this up in that we're going to use that cool word telomeres, right? And for those of you that don't know it, we'll put a little show note for you there. But so Doc, let's talk a little about telomeres and then the benefit and that study that they did in Israel with telomeres and whatever information you could add to that as well.
Yeah, there was a study that was published, I think it was 2022, and the Israelis have been working on the same data set, which means like the same population of people, and taking them through a number of different tests and doing all these studies on them since about 2017-ish. And I was in Israel in 2018, I think it was, and I got to see their program and I saw that what they were doing, and they showed me all these studies that they were going to be publishing over the next 3 to 4 years, and they just kind of slowly published them over that time frame. Excuse me. So the study you're referring to is one of the last ones that they published of the series. And this is kind of their coming out moment, let's call it, in the sense that they published a study on this group of healthy aging individuals. They're over 65 years of age. And what they did is they looked at something called telomere length. They looked at something called senescent cell populations. These are the types of cells that accumulate in our body as we get older. They're also known as zombie cells. Their cells are cells when they get old. What they're supposed to do is either regenerate themselves or die. And we have all these mechanisms that are supposed to help them do that. But as we get older, those mechanisms get lazy. And so you have more of these senescent cells that build up, and they're associated with things like inflammation and cancer and degenerative diseases, and also dementia as well. So what the study was able to show is that telomere length increased about 20% after 60 hyperbaric treatments. This is Monday through Friday with weekends off for 3 months, to be clear. And then and then they also showed that the senescent cell populations went down about 30%. Now, Eric, I'm not really all that excited about telomere length overall, I have to tell you. I think it's interesting, and there's only a couple other interventions that have shown increasing in telomere length to be like at this kind of level that we're looking at in this particular study. But we really don't know what that means, to be honest, because telomere length is something that goes down as we get older. The telomeres are these ends of your chromosomes that get shorter and shorter and shorter as we get older, and then get so short that they end up, making the cell die. Okay. So we think that this has something to do with longevity, but we don't know if increasing them has any effect on longevity at all at this point. So the jury's out, I think. However, their senescent cell population is a lot more interesting to me because there's very few additional therapeutic interventions out there that can decrease this population as much as hyperbaric therapy does. And in addition, they published about 3 or 4 studies before this looking at the brains of these individuals and how they revascularized their brains. Even though they were normal, they have what happens after about the age of 50 for most of us is that our brains start shrinking because the blood vasculature, the microvasculature it just dies. It starts going away. And there's a lot of different reasons for this. Often it's inflammation or infection or poor nutrition, et cetera. But the blood vessels start dying, the brain starts shrinking. Their brains were revitalized with hyperbaric therapy, and they saw new blood vessels, new tissue that was being put down. They also did cardiovascular exams. They saw new heart. The vascularization of the heart got better. So they did testing on something called VO2 max testing, which is how much oxygen you can use on a minute-to-minute basis. So that increases as well. And they also did studies on erections, because how can you get guys to do hyperbaric therapy for 3 months? You can tell them their erections are going to get better after they're done. And so it's one of my favorite slides to show in lectures is an MRI, a very specialized MRI called a functional MRI of the penis before and after hyperbaric therapy. And so the classic headline after the study was hyperbaric therapy is natural Viagra. And I don't know if we'd go that far.
Amazing.
Because Viagra can work in about, an hour, as opposed to hyperbaric therapy working over 20 to 30, 40 treatments, maybe 60 treatments. But it's a very compelling information and data coming out of Israel related to that. But I know it's a lot of hyperbaric treatment, and it's a lot of time to be spending in the chamber, for sure. So my sense of things, Eric, is that if you're pretty well optimized overall and you decide you want to do hyperbaric therapy, you don't need to do 60. I think the minimum is probably about 30 for a lot of those benefits. And then probably doing it periodically over time, 30 every year, every 2 years, depending on how healthy you are, to continue to maintain those kinds of effects.
So that's going to lead me to the question that we'll talk about some other topics, but for hyperbaric. So Doc, when you say 60 or 30 sessions, is a session usually an hour long? Is it 45 minutes, an hour and a half? What is the recommendation time? I mean, we say an hour in general is usually the minimum, but tell us a little bit about that.
Yeah. I mean, so typically it's either 60, 90, or 120 minutes, but mostly 60 and 90 minutes. And the milder pressures for neurologic indications are usually 60 minutes, and because the brain is more sensitive to oxygen and pressure. And then the deeper pressures, usually below 1.7, 1.8, but definitely 2.0 or 2.4. That's when we're using, that's when we're thinking about this in a different way. And the other thing we're also thinking about as well is, like, we're thinking about 90-minute sessions. We're also thinking about air breaks. These are breaks of the oxygen that you're breathing. Instead of breathing the close to 100% oxygen, every 20 minutes or so, you take off your mask and you're breathing just the air in the chamber. This is called an air break. These are helpful for prevention of something called oxygen toxicity, which we can talk about. Very rare, but happens in people that have neurologic issues or cardiovascular issues that are going to the chamber. They just have to be screened ahead of time. But there's also a therapeutic benefit, we think, of having these air breaks that actually increase the capacity of the system to make new mitochondria, to help decrease inflammation, to help release more stem cells as well. So the fancy term for that is called the hyperoxic hypoxic paradox, or HHP for short. But in general, we think it might be more therapeutic to add those air breaks in.
And how long do the air breaks last for, Doc, when they take the mask
5 minutes
off?
at a time. So 20 minutes of oxygen, 5 minutes of air, typically.
It's great. That's a tidbit that I hope our listeners are listening to. It's good to know this stuff.
Oh yeah. The other thing to mention is that I have created. So the thing about hyperbaric therapy is that it's a black box for many people still. And what I've been trying to do over the last decade is, well, especially over the last 5 or 6 years, is to help educate the world, the community that are interested in, like, how to use these kinds of devices, what kind of protocols to use. And I have found that a 30-minute protocol can be helpful, especially if it's paired with other kinds of things to help with cognitive performance. So or even physical performance. So because 30 minutes in the chamber is going to it's going to hyperoxygenate you. And then after you get out, you're going to have some time where you're going to have all that oxygen available to you to do things that you want to do. So a great combination is 30 minutes in the chamber at mild pressure, say 1.5, and then drop yourself into a cold plunge, and then you're going to have a fantastic day.
Nice.
That kind of thing.
That is, I love it. I haven't yet to try that one. I use all these modalities, but I haven't done them in that sequence. But, I have done, and because I've read about this, and I think you and I have discussed this way back when, about red light therapy, along with hyperbaric chamber in a sequenced order, because obviously the red light therapy is making their more available nitric oxide. Nitric oxide is what's carrying that oxygen. I mean, can you talk a little bit about that benefit and that power, like how that whole thing works?
Red light therapy, what it's doing, or near infrared light really, is what it's doing is creating more energy production in your mitochondria, in the part of your cell that makes energy. And what happens there is also, when you're under the near infrared light, it's also dilating blood vessels as well. So the dilation plus the energy production, and when hyperbaric therapy is then instituted, the oxygen is going to go where the red light was just being implemented, because that's where the more oxygen is required, because more energy is being made. As you can imagine, the body is always trying to triage itself as to where it needs to bring the most oxygen at any one time. And so you have these areas that are sort of within blood vascular beds called sphincters that kind of close or mostly close and just kind of let trickles of blood through. And then when you start doing something like moving your arm or something, then more of that oxygen is going to get there. And so you're using the red light as a way to kind of prime the pump in some ways. And then as a result of that, the oxygen is going to go to those areas more preferentially. So people like, with shoulder injuries, putting on a red light pad on their shoulder. And then after that, going directly into the chamber, you're going to get more blood flow to your shoulder as a result of that, as an example.
Love it. That's amazing. This is such cool stuff. I geek out on all this stuff, but it's because I do this. I do all these little things. I've been the last couple of years really tinkering with my own health, my own wellness, and then seeing how benefit. I mean, it's 49 years old. I train harder than I ever have. I've said this on a couple of other podcasts. I'm in better shape than I was in my early 30s. It's just adding these things and mitigating injury, of course, is one of the big things, but inflammation management has been a huge benefit. And that's one, and again, for brain cognition, I mean, that's the reason I really started paying attention at the trade shows. I started paying attention to the hyperbaric chambers. I started spending more time at those booths and asking questions. And what I learned was just incredible. I keep saying, the reason we're putting this type of content out there is I think more people need to know about this opportunity to add into their wheelhouse of managing their health.
Yeah. I mean, look, you're preaching the choir, man. I've been doing this for a long time, but I think the context for me is always the biggest aspect of this, is that it's not if hyperbaric therapy is going to be helpful for you, it's when. So just being aware of that piece. And if you have an acute injury though, if you have something that happens, do not pass go, other than going to the hospital if you need to, of course. But getting into a hyperbaric chamber is going to accelerate the healing process. It's just hands down. It's across the board. And then you can support people if they need to, but in general, an acute issue, you just need to get into a chamber to help recover faster. So that's what I say. If you have more of a chronic issue or a long-term goal, let's say like aging backwards, for example, like that's when it really does require more of a comprehensive analysis. And that's kind of my whole thing, Eric. I mean, most of the time people will connect with me across the world and ask about hyperbaric therapy. And I do consulting, as I said, with clinics, but I do with individuals as well, try to help them optimize and try to understand what kind of protocols would be helpful. But about 80% of what I talk to them about has nothing to do with hyperbaric therapy at all. It has to do with everything else that's required in my experience to really see the benefits and the changes that they want to see. So, and that's why I have a whole framework that I use in my own clinical practice, looking at optimizing vitamins, minerals, and nutrients, and gut health, and antioxidant status, and et cetera, and hormones as well, so that you have that as your foundation. And so, and of course, you might have to use other kinds of things that along the way that before getting into hyperbaric therapy, like optimizing mitochondrial function, making your tongue blue like yours is over there, or something like that helps before or even during, getting involved in and getting into the chamber.
So we're going to talk about mitochondrial function in a second. I want to get to that, but I want to just tie the bow on hyperbaric therapy. So we saw all these indications we've talked about earlier. Is there a cadence for someone who's listening, the general health enthusiast, really healthy? Is there a recommended cadence that they say, I want to integrate hyperbaric into my protocol because I know there's benefits, but to get like some of these benefits, like whether it's the senescent cell benefit or whether it's just, hey, I want some better brain function. I want to, is it weekly? Is it once a week? Is it once a month? What is it? And again, I don't want to, because it's very protocoled and prescriptive. I get that. But if you had to go up, and I always say go up 30,000 feet for a moment, what would it be for someone who's, as a health enthusiast, people like myself, like yourself, that are really paying attention to managing their care? What would that be?
So the 30,000 foot view here, to keep it general, because I think it's very individualized depending on people's goals. Everybody says they have no goals. They just want to be healthier, but that's usually bullshit. They usually have very, very specific things that they're interested in, in my experience. But what I would say is that 30,000 foot view of this is that I think of hyperbaric therapy in two major buckets. One is when you're going in a protocol, when you're going in 5 days a week for a period of time. And then one other bucket is your maintenance period, when you're going in periodically, sometimes 3 days in a row, but usually it's just maybe say on average 2 or 3 times a week, or maybe a couple times every 2 weeks. I mean, there's no prescribed way to do this. I mean, and in the sense that this is why I created my company. It's called One Base Health. And the idea with the company was to try to create protocols for people to do short-term and then long-term, and then understand the difference between maintenance, understand the difference between maintenance and protocols, and how you can actually integrate this in with the other therapies and the other practices that you're doing. Right. So, and that's really what it comes down to. Like, what other technologies do you have? Like, how are you going to integrate this stuff? And so nobody was doing that in the hyperbaric space. And that's why, my company, that's why I developed it, really, was that I wanted to educate people on how to use hyperbaric therapy, but I also wanted to educate people on how to integrate it with other modalities and then figure out how to use it in these two buckets, the protocol bucket or the maintenance bucket. So 30,000 foot view is you have protocols, you have maintenance, and then you have integrations. And then all those things change depending on whether you're on protocol or whether you're on a maintenance phase. And typically it's sort of like the reverse order. Like when you're on your protocol phase, hyperbaric therapy is primary. Okay. When you're on your maintenance phase, it's the other stuff that's primary. And you're using hyperbaric therapy as a supportive in those capacities. So.
Yeah, that's kind of what I used it specifically. I had a small surgery that I had to have done. And I protocol BPC 157 with hyperbaric chamber with red light. I mean, it was like, but my recovery time was like insane. Like my incision was like, it's nuts. Like it's crazy how it works. I actually wish I would have daily photographed my incision, and I didn't, but kind of regretting that now.
Next time, hopefully there is one. So hopefully there's not, but if there is.
And I look at people like myself now that I do. So I'll try to get hyperbaric in at least twice a month. It's not like one of my major protocols. Like I cold plunge, 4 or 5 days a week. I red light therapy minimum 3 days a week. It's just the inflammation. But I've started to say I should probably even myself integrate hyperbaric a little bit more. I do everything. I do the NAC, like I do all of the other things around it. But I always say, like, if I'm feeling like a little brain foggish and stuff, like I notice it like drastically when I do and don't do it for long periods of time. So again, I'm very much in tune with my health and my behaviors and my performance. Most people probably aren't as neurotic about it as I, but I do notice a significant difference though.
Yeah, 100%. I mean, when it comes down to it, if you have a chamber to utilize at your own home, or in your case, in your own clinic, you get to kind of feel it out too, right? These are that's why it's really not overall prescriptive, and just I'm trying to give a 30,000 foot view here, but for every individual, you're going to figure out what works best.
Yep. And then, so moving to the other topic quickly, and I can't end without having this part of the conversation, because if you haven't noticed through this conversation, I'll give a camera view here, but that blue streak down my tongue is, as it's known in the industry, it's called, what do they call it? Smurf tongue, I think they call it. It's got all kinds of funny nicknames. But it's a product that called methylene blue. And Dr. Sherr, he's got a company, Troscriptions, that he introduced me to a while ago. And I knew nothing about methylene blue until I met Dr. Sherr, by the way. It's a troche, and I put mine on the back side of my cheek. You start, but I started with a half a square. Now I do a full square, and there's a few different types of, and I'll let Dr. Sherr speak to this, but I did mine yesterday. I was telling the doc before we got on the show, my urine is now no longer blue, because it gets blue for usually a day or a couple hours, but my tongue is still stained. And this is after 3 different sessions of brushing and, a teeth whitener, but it's a very small trade-off, in my opinion, and by the way, Doc, I did 2 interviews. I interviewed an executive staff member with a blue tongue on a Zoom call. I actually had to tell her, I'm like, I don't want you to think I was eating like blue M&Ms or Skittles or something. And she was laughing. We talked about methylene blue for a half an hour. Nice. Yeah, and she knew what it was.
Yeah, we'll say the blue is the new smart. So it's not why my tongue is blue. It's why yours is not. But at the same time, we have a couple different products. It's the name of the company is called Troscriptions. We make these things called buccal troches that dissolve between your upper cheek and gums. They're these little squares that are scored, so you can make it in a quarter, a half, or a full kind of dose. 2 of them are based on something called methylene blue, which does stain your tongue blue if you do use it as a troche. We have a pure methylene blue troche called Just Blue. That one Eric, can actually be swallowed as well, and you can play around with swallowing it and see if that gives you the same mitochondrial effects. If it's on an empty stomach, it typically will. But our other combo is methylene blue with nicotine, caffeine, and CBD. So this is our focus, flow, get shit done, productivity troche. And that one's better in the mouth because it's going to work faster. And it gives you about 3 to 5 hours of feeling really nice and focused and productive, which is great. And we have another product called Trocalm, which is more for relaxation, stress reduction, which is got CBD and CBG and GABA, and a very specific type of GABA and kava in there that really works great for stress and anxiety. But all these products kind of work in my context as ways to help people right now while they're doing the more work of really trying to optimize over the long term. And methylene blue is a really great example of that because it really does a really nice job with optimizing mitochondrial function. So this is the part of your cell that makes energy that we've been talking about. And it helps support function, decrease inflammation. I call it energy and resilience in one compound, which is very unlikely. Very unusual, excuse me. There's very few compounds that build more energy in the system, but also help you with the detoxification process at the same time. So low doses are great for mitochondrial optimization. Higher doses are really great for acute infection, for acute trauma, ischemia, things like that. So we have a professional line that's obviously only available to professionals, where we have something called Tro Plus Blue, which is our higher strength methylene blue as well.
Wow. Yeah, it's like I said, it was such a cool product. Like when you introduced it to me, I was like, anything I could do to optimize my mitochondrial function, right? So I started it, and I don't know if my frequency, my cadence of taking it is the right cadence, but I kind of use it when I want it, like when I feel like I need it. Like I'm not on like a cadence of it. I don't know if there is a cadence, doc. Like, is there a cadence that people should be, if they're going to take this product, what it should be?
I mean, it depends on how much mitochondrial dysfunction that you have in general. So if you're more compromised, you're going to need it more often. If you're less compromised, you need it less often in general. So, and then I also say that, of course, there's going to be different times when people are more stressed. If you're traveling, if you're not sleeping as well, if you're having more stress, then that's when you're going to need more support. And that's when the methylene blue can be really helpful.
Great. And I didn't want to end this conversation without talking about it because I'm enamored by that product. I love it. I did it yesterday.
Awesome.
I have done the other one.
I use it in combination with hyperbaric therapy all the time as a way to support people that have a lot of ongoing inflammation. And I also use it in my athletes and other top performer kind of people after about 3 to 4 hours after hyperbaric therapy as a way for them to help recover faster so that they're ready for the next day's training session, that kind of thing too. So there are lots of different ways that I integrate everything that I do. But in the end, I'm a clinician. And so I try to work all this stuff in if it's appropriate, and not always, but methylene blue tends to be one of those things that I can add in pretty easily for most people pretty quickly.
Doc, this has been incredibly helpful for not only myself. Every time I talk to you, I just learn a little bit more every time. But hopefully, our listeners, as I always say, they got a little nugget of information. Listen to this podcast with a pen and paper because you're always going to be able to jot something down. So, Dr. Sherr, where can our listeners find you if they want to get more information about you, your companies, your Troscriptions? Where's the best place they can find you?
Yeah, so that's a good question. So, for my individual consultation, like with clinics, with clients, that people all over the world, that's the easiest place to find me is drscottsherr.com, DRSCOTTSHERR.com. So just not doctor spelled out, but my full name. And I'm on Instagram at Dr. Scott Sherr. I do some posting there. I'm not as much as other people, but I do post when I can. And my company is called One Base Health. So you can go to onebasehealth.com. And that's where my company we have a website, we have various chambers on there. We have our education platform. I mean, we're an ecosystem is what I'm creating with that. And so there's a phone application that people get if they get one of our chambers that has the protocols and the integrations, and that's being built out. And really excited for some smart technology that we're building as well to make the chambers better and more safe and faster in various ways and accelerating results. So that's the place I'd find stuff about my company, onebasehealth.com. And then the Troscriptions is at troscriptions.com. You can find that online. You can also find us on Instagram at that handle as well.
That's awesome. And outstanding stuff. And Doc, thank you for everything you do, right? And thank you for your continued study and research and your passion for this industry and the field we're in. I appreciate it. The world appreciates it. And for you listening and watching, thank you for joining us for another outstanding episode of Aging Backward, Growing Forward. Please join us again for our next episode. We're going to continue to deliver as much of the content, the truth, and amazing data about your health, your performance, and optimization we can. Until then, we'll see you next time.